In the last two videos, we talked about X-rays and CT scans. And in this video, I want to talk about the third major type of medical imaging, which is MRI. You've probably heard of this. It stands for magnetic resonance imaging. Sometimes you will hear people say MR imaging because that's maybe the most appropriate way to use the term. MRI first of all, works differently from X-rays and CT scans. X-rays and CT scans depend on using ionizing radiation in the form of X-rays to image the body. MRI uses a magnetic field, as the name suggests, to image, well, really what it's imaging is water. It's imaging water in your body. And technically it's imaging the hydrogen in water. But because there's different concentrations of water and it's bound up in different ways in tissue like muscle, fat, tendon, ligaments, skin, bone marrow, and even the fluids that are flowing around in your body, MRI is super nice for looking at lots of different soft tissue injuries as well as the structure of bone as well. So, MRI Pros. Really detailed. You can see that right here. This is a MRI of the quadrant of the thigh in the transverse plane. I think this is the left leg. So this would be the quads up here, and then you've got your hamstrings and the deeper muscles back here. And you can notice, like, we can really see the individual separation of the different muscles, which is incredible. You can see how much fat there is. You can see the structure and the shape of the bone, which is great. So it's really detailed, especially for soft tissue. Because MRI relies on magnetic fields, it also has no radiation. So, safer. Cons, though, slower. If you've ever had an MRI, you know it can be slow depending on how much of the body you want to image. It can be 30 to 60 minutes plus. Like CT scans, these are expensive because keeping superconducting magnets to create these massive magnetic fields maintained is not cheap. It's also not as detailed as CT for bone, so not as good as CT for bone. And by this I just mean let's say bone structure, because you can quite obviously see bones just fine. But one of the things you may have noticed on the CT scan, and let me bring that back up so I can show you, is that you can get a little bit of a better picture of what's going on inside the bone. There we go. So you can get a little bit of a better picture of the structure here, and there's even some nice, maybe more research grade CT stuff that you can get the micro architecture of the bone. But of course the trade-off is you got to bombard the body with radiation to do it. The other con with MRI is it's not, and maybe this is like more of a technical thing, and I'm running out of room here, so maybe I'll put it up here. It's we don't get quantitative measurements of bone either. Not quantitative. And by that I just mean you can't measure bone density, or at least not easily. That was one of the benefits of the CT scan, is that you essentially get a DEXA scan for free. MRI is great and has led to a lot of medical clinical advances. It's also a great, just a really good way to see what's going on inside the body. I really like this figure right here. I know I mentioned my first week, one of my interests is long-term health benefits of exercise. This set of MRI slices of the quadriceps of 3 different people is a great way to demonstrate that. So here's the quads and hamstrings of a 40-year-old triathlete. You can see bone right here, and then all this gray stuff is muscle, and there's a teeny little bit of subcutaneous fat out here. 74-year-old sedentary man. This is muscle atrophy. Look how much smaller the quadriceps are. The technical term is sarcopenia. Sarcopenia. Sarco as in muscle, like sarcomere, which we'll talk about when we talk about muscle structure. And then penia, I think loss. You may be familiar with osteopenia, which is loss of bone density. But great thing about exercise, and the great thing about MRIs, we can visualize this, staying physically active throughout your life allows you to maintain much, much, much more muscle mass. And as you might guess, you are going to fare much better if you stumble when you're walking, if your quadriceps look and your hamstrings look like this versus like this. So if you wonder how it is that, say you're doing occupational therapy work and you have clients who can't get out of their chair, can't get out of their sitting chair after they're done watching television, the reason is probably their muscles look like this. And so this is a good reason for using strength training throughout your life. And the high quality imaging of the MRI allows us to see this. One other thing I want to note about MRIs is that sometimes they are, you can combine them with a contrast agent. And in that case, in the case of, let's say, contrast agents, it is possible to do this with X-ray and CT as well. It's just less common in sports medicine applications. If you want to image the inside of a joint, you can do something called an MR arthrogram. Arthro means joint, so like arthritis, right? Joint inflammation. Gram, like image, Instagram, image focused also. So magnetic resonance joint image. How this works is you put a contrast agent, and a contrast agent is just some chemical that has 2 properties. Number 1, harmless, for reasons that will become obvious soon. And number 2, shows up on the MRI, like lights up. Let's say lights up on MRI. And why a particular compound would do this has to do with how the hydrogen in the molecule is set up. But technical details that aren't really important for our purposes. But what you do is you take that chemical and you inject it into the joint, so with a big long needle, or not a so long needle if it's a joint closer to the surface. We're looking at the shoulder here. We're looking at the glenohumeral joint. This is the head of the humerus, and the rest of the shoulder joint is over here. I believe this is also a transverse plane slice, and it's hard to see what's going on, of course, but what we've done is, what somebody has done, is they've injected a contrast agent with, some needle into the shoulder joint, and that contrast agent diffuses out into the joint, and then you can see where it goes. And you might be familiar with labral tears to the shoulder. It's also, by the way, possible. We talked about confusing anatomical terminology earlier. You also have a labrum. You have a labrum in your shoulder. It's like a ring of cartilage that kind of helps keep your shoulder in the right place. You also have a labrum in the hip as well, which does a similar thing and is also susceptible to being torn. But the benefits of the MR arthrogram are that we can see where there is fluid going where it should not be, and it gives us a contrast, and this is why it's called a contrast agent. We can see this tear in the labrum, which is kind of this area right here. We can see that it's torn and that this fluid is leaking out into area that it's not supposed to be. So this is really common for shoulder injuries. It's really common for hip injuries because on a regular image, this area tends to be dark. Like it's very, very dark. Do I have an example of that? Maybe. I think I have a knee MRI here, if I get this thigh out of the way. Maybe not. Well, generally, without a contrast agent, this area is dark, meaning you can't really see it. So contrast agents are nice for that purpose. So that's MRI. Super detailed, super slow. Well, not super slow, pretty slow. Pretty expensive, but no ionizing radiation. So probably, you know, beyond your kind of typical, you walk in the clinic and they give you an X-ray. The MRI is usually the next step, and we'll use them in this class for imaging things like muscles, tendons, ligaments, and so on.